Sounds like a really simple question, but I know is not always, which is simply how is CFS ME diagnosed?
Okay. So sadly, as yet, we don't have a simple molecular diagnostic test for ME/CFS that's available in your community ChemPath laboratories. And that means clinicians have to use clinical case definitions to try and get a diagnosis. And there's probably three of those that are commonly in use, more modern ones. The first one is the Canadian Clinical Consensus, which was published in 2003. And I must say, when I first read that, I thought, this is tremendous. It just actually described my daughter's illness to a T. Then that's been updated in 2011 to give the international clinical consensus. And then in 2015, the Institute of Medicine of the Academy of Sciences in the US came out with their own kind of variation of that to try and make things a little bit simpler so ME/CFS would be recognised as an important disease. I have to say Ros Vellings, who's been the major clinician in New Zealand who's diagnosed ME/CFS, has used predominantly the Canadian consensus clinical definition, which, as I say, I think is good both for clinicians and also for research. There is, of course, a tilt test for orthostatic intolerance that clinicians can use in their rooms when they see patients, which will help with the diagnosis. This is where you can get a patient just to lie down on a bed, and then after about 5 minutes, in theory, if you've got one of these beds, you can tilt the bed up, but alternatively just get them to stand up or even lean against a wall and look to see if their cardiac output stays the same or not. And if their heart rate goes up and blood pressure goes up, then there's some evidence of orthostatic intolerance. And so that's an indicator, not an absolute test, but it's an indicator that the person might be suffering from ME/CFS.
I'd just add to that. So I have ME/CFS and have a diagnosis, but I don't have orthostatic intolerance. So it's very common and many people have it. But for those of you who don't, I think very roughly the general criteria is trouble with brain fog, tiredness that is not relieved by rest, and post-exertional malaise, which we might talk about a little bit, but I guess in simple terms, everything you do makes you unreasonably tired and you crash. That's a rough gist of the kind of criteria that you'd be looking at. Yeah.